the things they don't teach you in medical school, like how to manage and grow your practice into a successful business, and how to navigate the increasingly complex world of health systems and health insurance relationships. Doctors can find themselves so caught up in business issues they have a hard time focusing on their patients. Take it from Dr. Yesh Navalgund from the DNA Advanced Pain Treatment Center in Pittsburgh. Nick Spanakis helps to ease Dr. Navalgund's financial pain. He's a healthcare banker heading up the Healthcare Business Banking Group at PNC, a sponsor of our region's business. And welcome. Good to see both of you.
Thank you.
Thank you very much.
So, Doc, am I right that you go through all those years of training, all the residency and everything else? They don't spend a whole lot of time teaching you business management practices, right?
Actually, no time at all.
Huh.
And I think that's one of the most challenging situations faced by young physicians coming out of training today. And that is that they wake up one day in July and all of a sudden they're not in training anymore and they're in the real world. And the real world is awfully cruel compared to what the comforts of the training world is like. And I think that most physicians today coming out of training are in this predicament. And I think from my perspective, I was fortunate enough to encounter some folks that helped me get through the difficulties of starting a medical practice.
Well, I remember I'm the son of a small-town dentist, and I think he learned the ropes of the business because he joined another dentist practice, and over time he it was an apprenticeship, basically.
Absolutely.
A lot harder to do that nowadays, given the way medicine works?
There's a ton of changes going on in healthcare today, and healthcare reform especially, and the drive now is towards more hospital-based physicians rather than private practice physicians, and the number of places you could, quote, do apprenticeship, per se, is reducing. And a lot of these folks coming out of training are looking at paying their debts down from medical school and all the other things that they've incurred over these years, and look at the hospital opportunity as a way to maybe substitute as an apprenticeship. And many of them find 2-3 years after working in that setting, they come out into private practice and realize that, in fact, the two businesses run completely different, and they have to start from scratch all over again.
And I would think healthcare businesses are probably a little bit different than the average business somebody's starting, the average entrepreneur. Mm-hmm. How so?
Yeah, very different. Actually, how Dr. Navalgund gets paid is not only very different, but very complicated, as you would compare it to, let's say, someone who sells a pack of gum across a counter. They get paid immediately for their services, whereas Dr. Navalgund, the way he gets paid is through a big stack of paper and a bunch of forms, and he hopes that the insurance companies or the government or whomever will reimburse him for the services that he rendered perhaps 60, 90 days ago. And then whatever's left over, if depending upon how he operates, he's billing the patient in hopes that the patient feels confident enough in the bill to remit payment for the remainder amount that's due to him. So it's very complicated, very different than it is for a retailer, for example.
Well, and I would think even within medicine or healthcare in general, there's got to be variations depending on the type of the profession, right?
Absolutely. Yeah, so you'll actually get someone, for example, who performs, let's call it aesthetic procedures where the insurance is not involved. And many times those providers, like a plastic surgeon, may require payment up front or in full prior to rendering a service, whereas someone who's practicing or treating someone's pain, if you will be collecting payment after the treatment's rendered. A little bit different point of view.
Wow. Hey, you wound up setting up your practice around the same time that PNC was setting up its business banking group. I mean,
yes. Did
you find them right away as you were starting out? And what difference do you think it made in terms of your being able to do it the right way?
Well, I think originally what had happened was I approached the bank not knowing that the healthcare division even existed. And I approached the bank with some concepts of starting up a practice, growing a practice, and really found myself being asked several business-type questions about revenue cycles and what do you think your reimbursement's going to be on this and that. And quite frankly, I look like a deer staring in headlights, not knowing what direction I'm going to be going in. But fortunately, they were able to point me in the direction of the healthcare banking division. And it was quite a good experience for me in that as soon as I sat down and said, I'm a pain management physician, I want to do A, B, and C, they were able to sort of look ahead, look at and forecast some of the hiccups and things that I might encounter over time, and plan ahead of time so that when we structured the different products within the bank, I was able to really capitalize on the advantage of someone having that knowledge.
Interesting. Really helping you with the business planning part of what you wanted to do. You kind of understood the medical part, but it's the business planning part. So for somebody, a physician working inside that hospital, maybe been out of school for a while, but wants to take the plunge into starting their own practice or their own business, what's the most important thing they need to know out of the gate?
I think having the right advisors at the table. You know, a lot of folks that are healthcare professionals will encircle themselves with trusted advisors, and many times, you know, coordinating those trusted advisors, their activities around what the physician wants to accomplish is important. You know, having a good bank that understands fully how practices run and the nuances associated thereof, and able to bring those advisors together to the table to actually have a holistic plan to help the doctor accomplish their objectives. I think that's what's important, is making sure that you have the right people at the table and that you're very transparent and full in your conversation with them.
Well, I guess it must actually increase the reward of practicing medicine if you don't have to worry about a lot of this stuff. Right?
That's exactly right. I think I find myself focusing more on what I do best, that is providing medical care, and not so much as to whether this month's bills are going to be paid because an insurance carrier has decided that the payment's going to be 90 days instead of 60 days from now. And I think from my perspective, it's taken a lot of anxiety about running a business and sort of moved it aside and given me an opportunity to do what I do best.
All right. Well, fascinating inside view of what goes on after the copay and all those deductibles and everything. Dr. Yesh Navalgund from the DNA Advanced Pain Treatment Center in Pittsburgh, Nick Spanakis from PNC's Healthcare Business Banking Group. Thank you both so much. Appreciate it.
Thank you.
Thank you.
Thank you.